Hi, Dr. Sunita. So nice to have you on our session today. I mean, it's been amazing working with you over the last couple of years, having a medical doctor on board like you to help us with our patients around the world and, of course, in our own country, India. A lot of people have been reaching out to us, Dr. Sunita. People are confused. People still see allopathy separate. People are confused about alternative medicine. People are confused about what integrative medicine is. But I remember the day that you walked into my clinic and we had a discussion, and then we went live together to talk about your story as a doctor and how lifestyle and everything that you did helped you with your own condition. So before we start off with the questions that I have you today to enlighten all of our audience and patients who may be watching this from around the world, Dr. Sunita, why don't you introduce yourself? From my end, Dr. Sunita is one of the most amazing doctors I've come across. She's been working very closely with me and my team of nutritionists and doctors for the last couple of years, handling patients with cancer, diabetes, Alzheimer's, lifestyle diseases, Rett syndrome across the world. And here we have her today amidst a busy schedule to share with us some of the learnings and things that we can all do to prevent. And if we have a condition, how we can make it better and possibly recover. Dr. Sunita, over to you. If you can introduce yourself, tell us a little bit about, what you've studied and how your life has led you to where you are today, including us meeting each other and you coming on board as our medical doctor. Please go ahead.
Thank you, Luke. And thank you, Luke, for giving me this opportunity. Like I am chatting with you and making my example as a motivation factors to other patients and clients as well. So, Luke, I am a medical doctor, postgraduate allopathic doctor, and I have gross experience of around more than 20 years spanning across this clinical practice, that is mainly in gynae ops. Then I switch over to public health, and thereafter then I joined your system as a integrated lifestyle medicine practices. So in that way I have completed more than 20 years in my career. Okay, and after doing post graduation, I joined public health public health as a public health professional, the ministry, because I would like to spread that message of whatever healthy lifestyle or whatever health programs to the wider range of people. Rather than limited to individual constituency, I prefer to be like it to go to the community. That was since starting, that was my liking. So with that objective, I joined the health ministry, central health ministry, what we call Ministry of Health and Family Welfare. So for almost more than 20 years, I am working with the Ministry of Health, Family Welfare. Okay, now come to why I joined you and how did I come across to you. So that thanks goes to my daughter, because she connected me to you and your system. And I myself experienced that benefit of the lifestyle modification. As I said that I was working with Ministry of, at that time I was in the major program. My core skill is mother and child health. So I was working on the public health programs related to mother and child health. So I was under pressure. Okay. So since my like early young time, I am following the healthy lifestyle and I always be very active. But two things I was missing. One was I was compromising on sleep. Okay, because of that work pressure and all that, and I was continuously on stress. So I was not coping with that my personal family liabilities and my professional liabilities. Both are non-negotiable at that time. So unfortunately, I got autoimmune disorder, and then I decided to, and then my daughter explored all these why the reason, and how we can recover from these autoimmunity disorders. Then I came across to your system, and I started listening your videos, and I improved my lifestyle, especially for that sleep part and the stress part. I improved my emotional well-being, Luke. I started giving me time, that just to get a happy hormone. So that helped me to recover my that disorder. At that time, for almost 3 years, I was on immunosuppressant. Fortunately, my doctor was also very helping. बहुत ही ज़्यादा cooperative doctor, very very helping and very knowledgeable doctor based in Noida. So he also helped me for this lifestyle modification, and I was kept on the immunosuppressant and all steroid everything. And fortunately, then I recovered from the disorder, and finally, like almost 2014, I am not taking any immunosuppressant. So sometime I like on this platform, sometime I got that opportunity to quote my own example whenever I see that patients or the clients are not very motivated to get this immunosuppressant because of the fear of their side effects, or if they are leaving the hope that if they are having this autoimmune disorder or this hypothyroidism, Hashimoto's especially, then they think that they are not going to be over from these diseases. So there, then I had to put my own example to motivate them, to make feel them that yes, there is a big hope. We can manage these disorders, these non-communicable disorders, with our lifestyle.
Great, doctor. And then I remember you coming over to our clinic in Mumbai, and you told me about the story, and we did a live right then to kind of inspire people that it is possible. That when a medical doctor makes changes to her lifestyle, integrated with, of course, medicine, that definitely helps you to, overcome the whole condition at some point. And then we went live, and the next day you were part of our team. I'll never forget that day. And thank you so much for all the amazing work you've been doing with our clients. Now, what I want to know today is you've treated so many people from autoimmune to diabetes to cancer. What are some of the tips that you would like to share, that you've seen? What are some of the things that people are doing wrong that if they correct it, they make lifestyle changes, their disease, their recovery can get way better, or their overall lifestyle can actually get better? What are some of your learnings considering all these patients that you've been handling?
So if I say about that reason for the lifestyle disease, because nowadays these lifestyle diseases are on rise. Okay,
Yeah.
especially in India, it's on rise, and in the ministry we call it non-communicable diseases. So these are on rise, and unfortunately in India, these diseases are taking lives of adult population. Okay,
Right.
so the government also emphasizes on the early detection, screening of these diseases, and lifestyle modification. So what I see here, the imbalance their diet, okay, unhealthy diet. We can say like more sugar, more intake of trans fat in form of fast food, because lifestyle is very very busy nowadays. We keep like we are traveling, we are moving outside, then we are sitting in office for long meetings. We are not carrying our lunch. We don't get cafeteria, canteen in our offices. At that time, we had to get fast food. So in that way, we can say that yes, there is some gap in our diet part.
Right.
And then we are lacking our fruits and vegetables. And at times, I am seeing that yes, people are not that physically active nowadays. They are mostly they are in that more and more sitting job. They are dependent on their digital mode. So movement is reduced, especially in India. What I am seeing, movement is little less. So in case we work on physical activity and very basic exercises like stretching, if we are not getting too much time or we are not getting facility of gym, at least we can do some strengthening exercises or stretching kind of thing, and ensuring a little more movement while working for our office things. Like I usually suggest that you can take some slow walk while on phone. That is possible. Like that walk can be done even in our own room. And then little bit improvement in your balanced diet. Not every day, but at least 70-80% time you should get balanced diet, which fulfill your daily requirement of macro and micronutrient. And this balanced diet, we usually ignore about water intake. We hardly we keep sitting in AC room, we hardly feel thirst, so we just forget about having our water. So hydration, that balanced diet, a little bit physical activity and exercises. I think if we work on these things, then we can keep ourselves very healthy. And then last but not least, that the sleep, non-negotiable, non-compromising, no compromises at all on the sleep part. We have to ensure the adequate sleep, not in the hours. Like I don't believe in that 7 8 hours, 10 hours, but at least whatever sleep we are having, it should be quality sleep. One
True.
should feel energetic on
Yeah.
waking up. Okay, so that kind of things we have to work. So I always keep guiding our clients, like awareness. Look, awareness is there everywhere. Awareness is very easily available. Okay, but
Mhm.
thing is the right awareness, right knowledge, and then the believe in that knowledge, and then making that knowledge the part of your practice or attitude. These are the important things. Okay, and then it should be sustainable. It should
True.
be
True.
sustainable. It's not that when the coaches are there, the coaches are behind our clients, then they are following. Once they are off to program, they are back to their track. It should not be there. It should be a sustainable kind of thing.
Right. Thank you, doctor. I want to go back to your autoimmune case, which you had. Okay. And now it's obviously in remission because you made your lifestyle changes. You worked with your medical team, which is great. An integrated approach worked for you. What are the things that you think put you into remission in terms of lifestyle? I know you mentioned emotional, and I know you mentioned sleep. What did you do to improve your sleep and to improve your emotional health?
For sleep, honestly, Luke, that time I was on sleeping pills. Okay,
Mhm.
I was depriving of sleep. Then I listened your videos, and I started taking sleep potion, and
Mhm.
then doing left nostril breathing, and that helped me a lot. Honestly, that is still part of my daily practice. Still I am doing that. And that my body cycle, my
Mhm.
sleep time, I always maintain that time. If I pass that time, then still I suffer that issue. So
Mhm.
I always maintain that I listen to my body demand. I go to bed in time, then left nostril breathing and sleep potion. That helped me. Now, no more sleep pills.
So
And
I
emotional well-being, yeah, for emotional well-being, I am very introverted kind of person, you.
right.
Then I
Mhm.
started like delegating my task, especially that family rigid. I started sharing my things to my family members, venting out, then like me time.
Very
I
good.
started paying some attention to my own health, going out, traveling, and all that. I started taking leave, though I know that all the time we are under pressure of work, but still, then I started taking leave. So I always suggest my patients always also that just think, if you will not be here, work will not be going to stop. The work will keep going on. So better you take your own time,
Yeah.
give some rest to your body and your mind as
Absolutely. Thanks for sharing that. And as we know, I mean, you improved your sleep and your emotional wellness. Tomorrow, if anyone with an autoimmune condition goes back to sleep deprivation or poor emotional health, the flare ups will come again. Because autoimmune is not really a disease, it's a condition, goes in remission, but if the flare ups come up, it's going to come back again. So, a great doctor, I mean, I've noticed you with my patients, a lot of patients elsewhere, and you're always very down to earth, very humble, very soft spoken. And there are a lot of people today who are very aggressive in their approaches. It's not just doctors, it's also sometimes there are nutritionists, personal trainers, and stuff. How do you maintain your humbleness? How do you maintain this very calm, calm way of speaking to your patients? I want to understand what drives that in you. Because today there are all kinds of people. It's not just the medical world. It's all, people are aggressive, people use ego, people use pride, people think they're the best. So what is it that you do? Because as you're speaking, there are many doctors who are watching this. There are many nutritionists who are and so I've always noticed this calm in you. Can you tell us what keeps you grounded and what keeps you calm with all of your patients?
well. I think that credit goes to my work experience, my
Mhm.
surroundings. I have
Beautiful.
come across variety of people during this journey, and then I always try to think from the other side of the table. You, like what I am thinking, it's not always right that the other person is always is also seeing in the same way. Okay, so I have to understand. And when the patient are approaching to us, they are in their deep pain. So we have to understand their pain. Then
Yes.
only we can come to know about their actual problems, issues. So
Right.
if I am getting aggressive, then there is no point for this consultancy. I have to be keep like calm and quiet. Okay, so we have to listen more and more from our patients. I this is my like one of the strategies that I say less, I listen more.
That's amazing. And that's why so many of our patients want to talk to you all the time, which is great. But thank you for sharing that. I think experience makes a huge difference. There are people who have all the knowledge they studied, but they don't have experience. And I think experience teaches us how to listen more, talk less, understand, empathy, have an
Yeah.
empathy in our approach with people, which is great. So, I mean, today cancer is becoming really, really big, and diabetes as well. In fact, India leads the world, cardiovascular. So what is some of the advice that you would want to give in general? Like, because you see so many of these patients every single day, what are some of the tips you would want to give the audience, like do's and don'ts that you think is valuable for us to know?
So see, Luke, these all these disorders, they are on rise. As I said earlier, also that autoimmunity, malignancy, the cancer, and type 2 diabetes, all that. So these all conditions are multifactorial. So some factors we can control, some not under our control. Like they are not modifiable, like age, sex, hereditary, environment, exposure to pollution. All these are not under our control. Okay, there we are helpless. But major risk behavior, that is under our control. Okay, like if we talk about cancer, uh, for cancer, yes, medical studies have shown underlying causes for cancer. In maximum cases it is not under our control, but yes, to some extent, like tobacco use. In India, the most common cancer for male is oral cancer. Okay, so if we reduce our tobacco intake, then we can, like, to some extent we can prevent ourselves for getting this cancer. Okay, so risk behavior, yeah, we have to work on the risk behavior if we want to get less likelihood for these diseases. So again, risk behavior is lack of physical activities, lack of exercises, movement, then our unhealthy diet, excessive use of alcohol, tobacco use, sleep deprivation. All these we have to work on those things if we talk about that prevention of these non-communicable disorders. Yeah.
Right.
And three tips, if you ask me for general people, it's like as I said that awareness is there, but that should be in your practice. Whatever knowledge we are getting, it should be in our practice. Consistency, sustainability, and then I would say that yes, it's more and more promotion of these healthy behavior among our family and society. I make sure that whenever I take my call with clients and patient, I always suggest them that whatever messages we are giving on healthy lifestyle, it's not applicable only on you. This is applicable for your entire family. So better you spread these messages to your loved ones. So promotion. So in that way, we can improve our health of our society. And then, if nothing is possible, then we can at least work on the water intake, and then simple deep breathing. If you are not taking in getting time for more and more exercise, then at least we can work on deep breathing. So these are the very small modification or tips we can ensure making in our daily lifestyle, daily routine. Okay, so deep breathing, adequate water intake, timely sleeping pattern, then your balanced diet, simple diet, simple, no superfood, nothing special, no imported fruits, no imported vegetable, nothing, simple. I like your strategy because you are connected to our youths, and you have reasonably like logic behind each and every strategy. That is the best thing. So if people start working on those things, then we may change our scenario to large extent.
Absolutely, Dr. Sunita. Thank you for sharing that. I know you're busy, so I have one last question for you. The power of the mind. I mean, we see patients all the time, patients who have given up, patients who don't believe that, they can get sicker, and it makes a big difference. Tell us some of your experiences over your years. I mean, you have so much more experience than me, 20 years. But tell me where you've seen the power of the mind play a role in a patient's recovery or healing. If you have an example that you'd like to share with us, and your personal thoughts on the power of the mind, because while there's allopathy, nutrition, exercise, there's also the mind that plays a huge role. So it'll be nice for you to share something on that.
Luke, I don't have words if I talk about role of mind, really, because I have seen in my family, my sister got malignancy, and that was in terminal stage. But we worked on her like all this diet part. Nothing was there for exercises and physical activity except that superfood and all that. And she was very hopeful about her life because I was with her, and we were told about that she has only 6 months of life. But she got strength from me and my niece, and she survived for a long time. But only one single sentence from her oncologist, that that lady told, the doctor told her that now nothing can be happened with your malignancy and no one can save you. And don't believe Luke, after that her condition deteriorated drastically. Drastically, and finally we lost her. So that mind game we have seen in our family. And on this platform, I'm seeing whenever I quote this, my example, whenever I motivate patients for immunosuppressant or steroid, because these medicines are not enemy, like medical, because I am no allopathic doctor. So I give HRT, I give in my practice HRT, steroid, these all are the life-saving medicine.
Correct.
So if there's this need of ours, we have to be on the medicine. Don't scared of this medicine. Don't keep any fear. If you are taking this chemotherapy, this steroid with fear, you will definitely get side effects. I see these things. Mind came in my rural practice. Like in rural women, they are not aware about the menopausal symptoms and all these things. So they don't get any hot flushes and all those things there in rural. They keep working in the same way. But in urban, because Google is full of all this information, menopausal symptoms, perimenopausal, so we start getting these hot flushes, we start getting high BP and all those things. So this is the game of mind, Luke. And I'm seeing these things in my family, in my practice, in community practice, public health practice, and then on this platform as well. So we can't ignore this part. Not at all. Not at all.
That's amazing. Thank you so much for sharing that. That reminds me of a case as well. It was when I was just starting off my career, having success with cases of cancer. And I was in Dubai treating this young lady. And she was in remission. And she was in remission for about a year and a half. And then she went for her PET scan with her husband. And I remember the husband, I was on a flight to Chennai, and the husband told me that, Luke, she's going for a PET scan, but the doctor looked at her history and said, guaranteed, I don't think we're going to expect a good PET scan. This is after a year and a half. The PET scan came with a lesion after a year and a half. Okay. And the doctor told her that, you have 1 month left to live. Enjoy it with your family. And at that point, the husband messaged me, and I looked at the date. I still remember it was 9th of June. Exactly 1 month later, on the 9th of July, she died. A completely fit woman. So technically, if she didn't go for a PET scan and she didn't know about it, because there were no treatments to do for that anyway, she had lived a year and a half, but 1 month when the verdict was given, it all ended. The power of mind. She obviously chose to believe that. It's very difficult, So yes, I don't think anyone is God, no nutritionist, no doctor. None of us are God to decide who and when dies, because there are miracles all the time. Of course, we have to be, practical. If there's organ failure, you can literally predict when the body is going to shut down. But for everyone else, I think your message is a message of hope, Dr. Sunita. to millions of people out there that, we can imagine the best. We don't have to always imagine the worst. I mean, there are survivors and there are people who don't make it as well at every stage, but it doesn't mean that we stop believing. So Dr. Sunita, thank you so much for your time. And I hope people take these what I like about you are your lifestyle tips. So very simple. And that's what we need. We don't need complication. We don't need extreme diets. We don't need anything extreme. We just need simplicity with consistency. So thank you so much. Thank you for being part of our team. And thank you for helping all of our patients around the world. Thank you, Dr.
Thank you, Luke. Thank you.
Thank you.